Doctors of Reddit, what was your dumbest r/I am very smart patient experience? Story 1. RN here. I see some crazy stuff, but one thing that stands out was the time I was admitting a guy to the hospital. I can't really remember what for, but he was about 400 pounds, diabetic, heart disease, you name it. Anyhow, I'm at the computer going over some admission questions with him and his 10 family members who are crowded in the room with him. A few minutes in, he starts complaining that he's thirsty. He needs something to drink right now. So I get on my phone and call the nurse assistant and ask her to bring in some ice water. As soon as the words are out of my mouth, the whole family screams, "No! No water! He's allergic to water!" Well, this is going to be a problem. Turns out the guy had been drinking nothing but Sprite and sweet tea for years because of his water allergy. The next question the wife had was, where are we all supposed to sleep? The whole family, 10 people, were planning to stay at the hospital with him. You can't make this stuff up. Story 2. Was working at a clinic. I was speaking with a non-controlled diabetic patient about her sugar intake, and she said she drinks a 32-ounce soda every day. I ask her if it's regular or diet, and she replies with, "It's half regular. I let the ice melt first, so there isn't as much sugar in it." Sorry, but that isn't how it works. Story 3. Not a doctor, but I assist on a clinical trial, and my main job is screening potential participants. I have to ask a list of questions about their medical history and current drug use. And I have heard the wildest stuff I've ever heard in my life at this job. Some people just want to feel smart. One of my favorites was when I asked someone if he'd ever had an MRI. His response? "I never enter hospitals because I don't agree with their practices." Did you know homeless people go into hospitals for warmth, and because they feel bad for them, the doctors give them cocaine? He withdrew his interest when I informed him the trial would take place in a hospital. Think he was also the one that called me Big Farmer. Not pharma, farmer. Yesterday I interviewed this guy who, upon being asked if he had any existing medical diagnoses, told me that when he was born, he was admitted to a study on infants of greatly superior cognitive intelligence. When I told him he was ineligible for the study, he scoffed and said, "It's not a problem. I was actually worried I'd corrupt your data, since you probably don't have any other participants of my IQ. Wouldn't be fair to apply my results to them." Okay, buddy. Story 4. 80-plus-year-old patient who is declining with multiple diagnoses and about 3 decubitus ulcers. Daughter was adamant that her father be kept on his strict paleo diet because that would supercharge his healing. She had a stack of diet books. He simply wasn't getting enough nutrition to heal the ulcers. He didn't like the diet at all, by the way. At some point, you kind of have to stop being polite and just tell patients, family members bluntly that you don't have time for this stuff and what you recommend, and they can do what they want and just document everything. It happens a lot, but she sticks out. Story 5. Late entry, but maybe someone will enjoy. Recently volunteered at a free health screening event. Elderly lady walks up to have her blood sugar checked. Me. "Do you have a history of diabetes? Did you eat anything today?" The usual. Her. "My doctor told me to take these pills, but I'm not doing it. You know, they have a cure for diabetes, and they're just not giving it to me, so I refuse." Me. Actually, no. We don't have a cure for diabetes." Her. "Honey, you're just a nurse. You don't know. Those doctors haven't told you, and they refuse to let out their secret because they want to earn money from all those drugs." Me. "But then what do you do for your diabetes?" Her. "Nothing. I refuse to give them my money." Me. "No, but what else do you do? Exercise? Diet?" Her. "I don't believe in any of that. Those doctors are all liars and they just need to cure me. How can they find a cure for polio but not for diabetes?" Trying to restart this conversation 3 times, but she didn't even bother listening to the potential dangers of uncontrolled blood sugars. I eventually just had to give up. I guess a fasting blood sugar in the 300s isn't the worst situation you could be in as an uncontrolled diabetic. Story 6. TLDR, gross eyeball stories from eye doctor. I recently had a 30-year-old insulin-dependent male argue he knows when to take his sugar medicine. He had bilateral retinopathy and a severe vitreous heme in one eye. Legally blind. Driving a car, last eye check 8 years ago, lost glasses 2 years ago. Will need 4 or more surgeries, including an inevitable cataract. I had a patient tell me they clean their contact lens with milk because it gets the acid off them. I had a patient ask me if it was okay to look briefly at the sun for short periods of time to improve their eyes. I was amazed and kindly suggested they don't. Had a patient put eardrops in one eye. White part of eye, conjunctiva, scarred over entire cornea and was left with no light perception. Asked me if he should have come in sooner. It had been 4 months. He needs a cornea transplant, which sucks and takes over a year to recover from. Patient with a retinal detachment told me to put more medicine in their glasses to see better. Macula was off so they could barely count fingers 4 feet in front of their face. Had a patient wear contacts designed for 2-week daily wear leave-in for 8 months. They literally grew into and became a part of eye. It was repulsive. Had a patient with a 6-year-old translating. Basically no clue besides eye hurts. Her hand covering her eye. I asked to see the problem. Her eye looked like a shriveled up grape. The optic nerve was holding onto a shriveled up, decayed eye loosely hanging in the orbit. She wanted glasses. Had a lady put jock itch in her eye to cure her suspected fungus. I asked her why she thought it was a fungal infection, and she just had an inkling. They are rare. Cataracts on a 58-year-old male working rooftops for 30 years with no sunglasses. Best corrected vision was count fingers, 6 feet, one eye, barely seeing better in other. First eye exam. Mad when I told him he needs surgery and should not drive a car. Had a patient tell me the benefits of using alcohol wipes to clean her lower half. Out of the blue. I'm an eye doctor. Had a guy clean his contacts in the shower with shampoo because he was convinced it was better. Raging red eye 2 weeks later. Homemade contact solutions are always fun to hear. Vinegar? Salt water? Spit is not cleaner than fresh solution, but please tell me more. Had a guy recently come in because wife made me. Tried with tweezers to remove metal from cornea. Didn't look pretty. I removed the remaining metal rust with a needle and spinning burr tip brush. Antibiotics, Q 2 hours. Told him not to do that again. Had a patient crush a pill up and put in eyes. It was an eye vitamin but taken by mouth. Her eyes were angry. I had a patient walk in one day, no glasses or contacts. Had full penetrating cornea transplant, both eyes 17 years ago. Last eye exam was 12 years ago. Swore he could see fine. Clearly a transplant graft rejection one eye with no functional vision, and other was a gnarly looking good eye. I barely got him seeing with glasses on the one eye and can't drive. Uncontrolled diabetes too. Messy. Have had more than one patient argue with me about not seeing right. They either had 2 or more contacts in eyes or none at all. When they try to remove a contact that is not there, it causes a painful abrasion. Multiple women using non-approved glues to glue on fake eyelashes. Leaks and burns in eyes. Just why? Using fake contacts from the nail salon. Then it never ceases to amaze me when I hear, I just use the same solution until it turns brown or black. Every day. Had a patient using a homeopathic drop to cure itchy eyes. She had pubic lice living on her lashes and they lay eggs and bite. Repulsive. But still convinced the drops cause the lice? You pluck the offending lashes out and use a cream to kill the stuff you can't see. Thank God that was only once. I have to convince a lot of people to not use hand sanitizer in their eyes. Way too many, actually. I had a patient not taking her herpetic eye drops because she just wanted to pray instead. Yes, herpes on eye. Luckily, I convinced her to do both medicine and pray. Story 7. Oh boy, it's my time to shine. 1. A guy brings his wife to the ER. Her leg has a 7cm by 7cm wound, diabetic ulcer, with greenish yellow pus and what looked like a few maggots. Now, I took one look at her and referred her to the surgery department for admission, but the hubby is adamant on his wife's kidney disease. But doc, it's just a wound. You gotta fix her kidney first, doc. I read online that diabetes can cause kidney failure, and you gotta do something for that. I spent an hour convincing him that his wife would probably die before the kidney damage sat in by sepsis from the clearly infected wound. 2. During my pediatric internship period, one day I was in charge of general ward. Basic things: look after the kids, solve small complaints, cough, breathlessness, etc., etc. Evaluate new admissions. Now, where I work, interns are supposed to draw blood from children for tests. So I went about my job, and there's one little tyke who's a bit too active and jumps around when he sees the needle. The mother gives me a vile look and says, "You lot are just puncturing my child for your education." At which point the kid just screams even harder. Yes, I'm studying a blood draw at 2 in the morning by waking up a kid. That's what she thought. It took a fair amount of convincing, too. 3. I took care of a child that got measles. The mother and father were strongly anti-vax, but were yelling at me, "How can modern medicine not have a treatment for measles?" At which point I told her there was a preventative method, but you didn't use it. She asked me what it was, to which I replied, "Vaccinate your child." She said, "You're just one of them pharma lobbyists, aren't you?" Yes, I am a pharma lobbyist who wants to end children. 4. A lady comes screaming into the ER. Now, she's all dressed up, so are her 2 grown daughters. All of them screaming hysterically that their mother is going to die. I go by them and nearly get tackled by the sister-in-law, a husband of one of the daughters. "Save her, she's having an embolism." Shaken, I examined the lady, asked her where she was coming from. A wedding, that explained the dress. She apparently had too many potatoes. A shot of pantoprazole later, her embolism is gone. She had a bad case of fart embolisms. One thing I will never forget is how I learned never to be mad at a patient. Now, this was when I began as an intern. A patient had intestinal obstruction. We inserted a nasal feeding tube as the patient could not have anything per orally before the surgery. Problem was that they would always come and complain to me about how I didn't stick it properly. You have to stick the end protruding out of the nose to the nasal bridge. After 2 to 3 such episodes where I reluctantly dressed it, they complained that the tube is out of the nose, and lo and behold, it is out. It's very uncomfortable. Most patients try and pull the nasal tube out. I replaced it like 4 times. Poor guy was fed up by then. On the morning of the surgery, his wife comes and asks me, "Doc, can you just remove that tube so that I can give him some coffee?" Now, I got totally mad. I was working a 72-hour shift, so I scolded her by saying that if she or he didn't want the surgery, then I couldn't do anything, and it would be nice if they gave me some peace. She didn't say anything. The patient, 50 years old, with no other complications, died on the table. I couldn't face her. The moral being, doctors know more things than patients, but it's not always wise to bite their heads off. I could have convinced her it was impossible to remove the tube before surgery in a calm way. Since then, I've tried to be a better speaker to patients. Story 8. Obligatory, not a doctor, but I am a medic. Back when the Ebola crisis was huge and media was losing their minds over it, I had a very interesting call. There are definitely other I am very smart instances, but this was at the forefront of my mind, and it makes me both laugh and cringe at the same time. We were riding 3 deep, all-female crew, dispatched to a sketchy part of town in a bad apartment complex for unknown urine problems. Okay. I'm taking the back seat on this one, kinda just gonna observe. We're met at the ambulance by a late 50s, early 60s African-American male. Unkempt, yellow eyes, clothes that look like they've been slept in for a week, dirty nails, general uncleanliness. He asked us in a very thick accent where the men were. There are no men, it's just us. We all have the same training. If you're more comfortable with a man, we can get a male crew here, but they won't do anything different than we will. Women can't be in male positions. You should all be home taking care of your husbands and children. Sigh. One of these types. I respect and get cultural differences, but sheesh, it gets old. After going back and forth for a few minutes about our training and trying to explain to him in futility that none of us, at the time, were married or had kids, we finally tell him, look, we aren't here to discuss us. We're here to help you. You called us. What made you hurt so bad to call 911? We have to assess you. We can't just get another crew over here not knowing what the problem is. What issue are you having? My privates. I think I have Ebola. Cue the eye rolls. You have Ebola in your privates, I said. It wasn't a question. Yes, I just came back from Liberia last week and I haven't urinated in 4 days. Cue him spewing all tons of what his culture says about illness and Ebola. His cousin, who was a doctor in Africa, told him he had it, and it could be cured by sleeping with a virgin and eyeing all of us like we're meat. What the hell? We wound up ignoring him and continuing our assessment. He was so adamant about it though, cited obviously fake odds and facts, and bragged he had relations with several women in Liberia, and that's how he got Ebola. Okay. Are you in pain? Can we take a look? He let us get a set of vitals, but then he pulled his pants down, conveniently forgetting his request for men, and apparently the fact all of us knew nothing and should be taking care of our husbands or whatever. Well, the marbles were the size of grapefruits, and the pecker was turtled to the point it was basically inverted. His bladder was palpable and swollen too, so the dude was legit. He definitely had some issues going on. He was convinced he had Ebola, only in the privates. Also, I'm sure he was more shocked that we weren't fawning over his gross-looking genitalia, us being a crew of women. I should note, this dude very much so did not have Ebola at all. We took him to the hospital and we told the receiving nurse what the chief complaint was. She brought the doctor over and asked us to tell him to his face what the patient was complaining about. Pecker Ebola. When we went back dropping off another patient, we asked how patient 0 was. They laughed and said he just had some prolapsed organs down there and his pelvic floor was trashed. Had to stick a catheter down his urethra to drain the pee. No pecker Ebola, but he definitely was riddled with STDs. I don't know if this classifies as I am very smart material, but I thought it was relevant. Virgin sacrifices to help your stank situation. Story 9. Optician here. We had a patient who refused to let us use the tonometer, a machine for checking ocular internal pressure to diagnose glaucoma. He said that puff machines gives you glaucoma and we weren't going to pull that on him. He told us his father got an exam and had glaucoma after using that machine. His uncle and brother also had no signs of glaucoma, and after getting the puff test, both people had been diagnosed with the disease. Glaucoma doesn't have any outward symptoms before you start going blind. This idiot just told me he has a very strong familial disposition to glaucoma and refused to be tested for it. Story 10. This is a story as told to me by one of the EMS in the area. Had a guy present to the ER requesting an ice chest, ice cooler full of ice. After a lengthy discussion, this is the narrative sorted out as the story was erratic. Guy went to party. Guy met gal. They had fun dancing. She asked him to her place. She asked for some sensual saucy time. She asked to kick things up a notch. He said, why not? She pulled out a syringe and injected a drug into his wang. She pulled out a syringe and injected a drug into his lower area to make him have a harder and longer lasting time. They proceeded to have lots of fun, saucy time. Few days later, things are sore. Something's not quite right in the todger. Some red spot starts getting redder, larger, and darker across time. Things start turning black and smelling bad. He decides it's a good time to take some initiative, so he pulls out a knife and starts sawing at it to carve out the dead skin. Then he hits a nerve. At this point, he changed his mind to see if he can fix the issue and covered it in olive oil, then wrapped it in saran wrap. To fix it. Some more time passes, and he goes to the bathroom in a restaurant. He pulls down his pants, and the whole thing slides off his P-tube urethra like a corn dog off of a stick and lands on the floor next to him. He picks it up, goes and gets a cup from the vending machine, fills it with ice, and puts it in the cup to help keep it fresh. He wanders around for a few more days, then decides that his cup is getting too smelly. So he goes to an ER and asks for an ice chest full of ice. He gets taken to the ER. The ER docs consult urology, and it turns out that when he goes pee-pee, it just flings around everywhere like an unbridled fire hose on full blast. The hospital won't let him keep it, as it is a biohazardous tissue at this point, but he won't let the hospital take it until they decide to give him a receipt for it. Then the thing is taken to wherever they get incinerated, and the dude wound up admitted with a surgical uro consult. Moral of the story, don't inject stuff in your junk, even if it is from random strangers for saucy soiree time.